learning outcomes for the module on intramuscular injections. In this module, we will cover the following points: conducting the process in a seamless manner, preparing the injection, sharing procedure details with the patient clearly and concisely, giving injections in the proper manner.
I'm going to go through the IM injection procedure. This is vitamin B12 complex, hydroxycobalamin. It's always the same drug. It's in a community setting, so I'm still going to do the 6 rights of medication and go through the full ID check with this patient. I'll just go through the procedure now. So I would check that the area is safe to approach. There's no obstacles, wires or liquids, and do the 7 steps of hand hygiene. Palm to palm. Back of the hands, fingers interlaced, back of the fingers, fingertips to palms, thumbs, wrists, and leave 30 seconds to dry. Hi, my name's Helen. I'm the nurse looking after you today. Can I just check what you'd like me to call you?
Emma.
Okay, Emma, before we go ahead, can I just go through a full ID check with you? Can you tell me your full name, please?
My name is Emma Hargreaves.
And could you give me your date of birth?
26/9/63.
And what address are you at?
Number 2 Long Street, Northampton, NN2 7AL.
And do you have any allergies to anything?
No.
Not allergic to latex or sticking plasters, nothing. Okay. Are you quite comfortable at the moment? Not in any pain or discomfort?
I'm okay.
Feeling quite well today. Oh, great. That's great. Okay. So I would just screen the area for privacy and dignity, shutting the doors and windows. I'm just going to explain the purpose of my visit today. So I'm here today to give you a vitamin B12 complex injection. The drug's called hydroxycobalamin, and the injection goes into your muscle. We normally use the arm, the top of your arm, to give this injection. Is that okay with you?
That's fine.
So this drug, vitamin B12, is used to treat anemia usually, or vitamin B12 deficiency, and it does help to build the red blood cells and therefore help circulate oxygen around your body and make you feel well overall, generally. Side effects tend to be headaches, dizziness, there could be some inflammation at the site of the injection, and also there may be some stomach upset, a little bit of nausea, but these are sort of common mild symptoms. Anything severe would be like anaphylaxis, which is generally manifests as swelling of the throat and difficulty in breathing. And we do stay around for 30 minutes after the injection, just in case you did have a severe reaction. So that's what we'll do today, if that's okay with you.
That's fine.
All right. So is it okay if I just have a look at the site where I'm going to give the injection?
Okay.
So which arm did you have it last time? Was it your right or your left side?
My right side.
So you're quite happy for me to go into your left arm?
Yeah.
I'm just going to have a look. I'm just going to remove your clothes here and have a look. So I'm just having a look at the area where I'm going to inject, and it's free from tattoos, it's intact, and there's no breaks. I'm happy that that skin is good and I'm happy to use it. So I'll just cover you back up for now, Emma. I'm just going to go away and get my stuff together.
Okay.
Right, thanks. It's going to take about 15 minutes, by the way, so if you wanted to go to the toilet, might be a good time now. All right. Thanks. So because I've left the patient area, I'll gel my hands again, just a quick gel. And firstly, I am going to put an apron on. And I'll assume these trays have been washed with soap and water in the past 24 hours. I'm just going to put some gloves on and give them a quick wipe with alcohol wipes. I only need to do the tray that I'm putting the equipment in that I'm taking to the patient. The other one's just for rubbish. So I'm going to gather together the stuff I need. Firstly, I'll check the medication which I'm going to give, which is hydroxycobalamin. I've got here hydroxycobalamin, 10 milligrams in 10 mils. It says 1 milligram in 1 mil is the dose. So that one's okay to use, and I'll check that again before I use it. I'm just going to check the prescription to make sure the prescription is correct and legal. So I know I've got the right patient because I've done the full ID check. I've got the right drug, hydroxycobalamin, which I know she's due, vitamin B12. It's 1 milligram dose, which is correct, I know. The route is IM, which is intramuscular, which I know is correct as well. It's due once every 3 months, and it says it's due today at 1400, and it's got the date here, which is today's date, and it's signed by a doctor. She's told me she's got no allergies, so this prescription is legal and I'm happy to use it. So I'm just going to check this drug again. So I've got hydroxycobalamin, 10 milligrams in 10 mils dose it comes in. Expires 2021, and it's clear. There's no sediment and it's intact, so I'll put that in my tray ready to use. And I'm going to take a 2 ml syringe. This is intact and it's in date till 2023. I'll put that in my tray ready to use. I'll take 2 swabs, alcohol swabs, one to clean the patient and one to clean the bottle, and they are intact and in date till 2022, so they're okay to use. I need a drawing up needle, which is also a filter needle. It's intact and it's in date till July 21, so that's okay to use. She's an average size person, so for IM I'm going to use a 21 gauge needle, and it is intact and it's in date till 11/22, so that's fine. I'm also going to take some gauze swabs to open the bottle with, because it's a glass bottle. I'm going to treat it as a glass bottle. I've been told it's to be treated as glass, and I'm going to use one post injection, and the package is intact. It's in date till 2023, so there's 2 of them, and I'm going to now prepare my equipment for the injection. So firstly, I'll open the alcohol wipe and clean the top of the bottle for 30 seconds. And can I assume 30 seconds has gone, examiner? Yes, and 30 seconds to dry. I just put that into the tray while I get my syringe ready. Open it at the plunger end, keeping the key parts covered, and with the filter needle, open it at the key part, connecting it to the syringe, key part to key part, and that goes in the tray ready. And 30 seconds is gone. This is dry. I am going to make sure that the sharps bin is open so I can put the lid in. I'm going to treat this as a sharps and open it away from me. The whole thing, including the gauze, will go into that bin. Unsheath the filter needle, keeping the lid in the tray, and draw up more than 1 mil because you're bound to get air in it. So I would take up to 0.3 and keep the vial, don't throw it away. Resheath your filter needle. Do not push up against the filter needle because you could break the filter in it and all the glass or any sediment could come back into the medicine. Open your giving needle. Now, not any earlier. key part exposed for a minimum time, and connect the syringe to that. Put your sharps into the sharps bin, and I would really press down on this needle hard, because when you're trying to get rid of the bubbles, it can actually fly off if you're not careful. Make sure you've got no bubbles before you start to squeeze out any excess liquid, and you'll take the plunger up to the 1 mil mark, and the examiner will now come and have a look and check you've got 1 mil, only 1 mil, and put that into your tray. Get rid of these gloves, gel your hands, and take another pair of gloves for administration, putting them on when we get to the patient. So I'm going to take a pen with me to sign the prescription, and I'm going to take the gel, some gloves, sharp spin, medicine, the vial, an injection swab, and gauze for post-injection. And I'm going to return to the patient. Because I've returned to the patient, I'll gel my hands again. Okay, Emma, I'm back again now. Are you still okay to have the injection?
Yes, I am.
Okay, so I'm just going to uncover your arm where we said we'd give it. Now I need to locate the acromion process, so that would be at the end of the bony area at the top of the shoulder. You can feel a dip, and just below that, 2 fingers down, I'm going to make an upside down V with my fingers, and that is the area which I'm going to inject in. So I've sighted the area, gel my hands because I'm putting gloves on. Don the gloves. Firstly, wipe the area. So we can remember it was just here. Wipe for 30 seconds. 30 seconds is elapsed, and let it dry for 30 seconds. You can get the gauze ready between 2 fingers that you are giving the medication with, and unsheath. Can get the sharp spin closer. Unsheath the needle. You might have to hold on to the green part of the needle. Now, this is stretch the skin. Emma, a sharp scratch is coming. Because it's IM, stretch the skin and give it in a dart-like motion. Ready, Emma? Sharp scratch coming. And give it up to, leave 1 centimetre exposed. Don't let go of the needle at all at any time. Now, remember to withdraw to check it's not in a blood vessel, and give it over 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hold it in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And withdraw swiftly and put it into the sharp spin. Just going to hold it for a second and check there's no blood. It stopped bleeding. Okay, so I can quickly take my gloves off, gel my hands. Emma, it's being given now. So I'm just going to cover your arm back up. All right. So like I say, I will be around for 30 minutes. I'm just going to sign for the medication and get rid of the rubbish, and I will come back to you. Just need to write stuff up in my nursing notes. Okay. So I just need to sign for that medication, put today's date and the time, and we're just going to check if the prescription has an area for the batch number on. We're going to put the batch number on, which is batch number 2468. And because this is a sharps, I'm going to put it into the sharps bin. If there's an area on the prescription asking for any details, I would just say injection given in left deltoid muscle, area free from breaks and intact. Effects and side effects explained to Emma will stay with her for the next 30 minutes. And I will just go and get rid of my rubbish in her domestic waste because it's her house. She doesn't have clinical waste. And I would just go and document what I've done in the nursing notes. And I would clean this tray. Gel my hands before I leave the house. And that would be the end of the procedure.